Thank you, Dr. Chima, for that lovely introduction. And I would like to welcome you all. And I hope I give you something to take with you for your own wellness, because unless we take care of ourselves, I don't think we can do justice to our patients. And some of these protocols and tools that I'm going to go over, you can even use it for your patients too. That's a disclaimer I had to put. So. I would just start with, think of human evolution. We were supposed to be, not supposed to be, we started as food hunters, gatherers, living in tribes, no condos and no homes, no separate nuclear families, living as tribe, helping each other, sitting by the fire at the end of the day, socializing, talking, and then sleep, and then start again. So from there we have come to a point where our jobs are being threatened by artificial intelligence, where you don't even need a functional human to do these activities in which you need a lot of cognition. So from there we have come to this point, and we are quite isolated from the natural environment that we were supposed to be in. And that is one of the major reasons that we are not in sync with our environment. And that's why we see all these major causes of mortality, and it's not a surprise to anybody that heart disease is the major cause of mortality around the world. Second is cancer, then strokes, accidents, neurodegenerative diseases, and mental health disorders. And behind most and almost all these diseases, it's the culprit, I would say, is a good extent is aging. And if we optimize our aging, and then we can make a dent in all these possible mortality causes. So I'm going to go over some tools that will help us to sync with our circadian rhythm. I'll talk about exercise, which is the elixir of life. It's like unmatched. It's the free, most potent drug, I would say, that can help us to have a long and a good health span. Then hormesis and xenohormesis. I don't know how many of you know meaning of this. So the meaning of hormesis is, you can think of what doesn't kill us makes us strong. So these are the stresses, physical stresses, that make us stronger with regards to our immune system, our general functionality. So that's called hormetic stress. And xenohormesis is when you consume something or a plant that has been in a stressful environment, and those chemicals that these plants make, when we consume them, they make us more robust and more adapted to the environment. Light exposure, as I said, we have been quite away from our natural habitat technique, and so we have undermined light exposure and what role it can play in our general well-being. Nutrition, that's my passion. I'm a gastroenterologist. I should be knowing about nutrition, so I will briefly touch on that. And meditation and stress reduction, and if time permits, I might do a 10-minute, very quick meditation session before we leave, if time permits. And having social connections, and that sleep that I put in big is not a font error that I made it big. But sleep is probably, it anchors us around all the above activities, and these are all interconnected. You cannot take one away from the other, and they all come down to wellness, sleep, and then rest of the activities. Sorry, the clicker is a bit slow. So I would start with the activity, which is actually not even an activity. It is just going to bed, closing your eyes, and let the body take over and sleep. So this is very important to understand what sleep does to us. And once we know what sleep does to us, we can optimize all the other activities that I discussed earlier in the previous slide to optimize sleep and to optimize the other activities. So they are all interconnected. So it's now very well known that Alzheimer's or cognitive decline is associated with poor sleep over the years. And there is a cleaning system in our brain. It's called lymphatic system, And this system clears our brain of the tau proteins, which are implicated in pathogenesis of Alzheimer's. And you can see that animal studies have shown that even one night of sleep deprivation can lead to increase in these proteins in the bloodstream and CSF and brain. And this system gets activated during our deep non-REM sleep that happens in the earlier hours of our sleep. So that uninterrupted earlier hours of sleep is very important for this lymphatic system to work. And again, over the years, when this system is not working to its optimized state, then these proteins start accumulating and can lead to cognitive decline and Alzheimer's. And also, the decline in deep sleep starts from mid to late 30s, and males sooner than females. Don't know why, but that's the physiology. And as we age, it gets worse and worse. And in fact, one of the predictors of early signs of or symptom of Alzheimer's is bad nightmares. That's what people can start getting even before they get Alzheimer's. That could be a warning sign that they are going in that path. Insulin resistance, metabolic disease. So insulin resistance is very central to a lot of the metabolic disorders we see, and if I have to just put it in one sentence, basically the amount of insulin you need to optimize or to keep a euglycemic state. And if you need higher, you have a insulin resistance, and if it's done at a lower levels, that you're quite insulin sensitive. So the study has shown that only in one night, if you sleep like 4 hours or less, it induces insulin resistance in even healthy subjects. And there are certain mechanisms that are responsible for that, and you can try it. If you don't sleep well at night, next morning check your blood glucose, and it could be higher than what it has been in the past when you had a good sleep. Then if you poor sleep, also another big dent that you can make in your metabolic health is by optimizing your blood pressure, and that also is adversely affected by poor sleep. There is an increase in risk of cardiovascular mortality, and we know that now. And poor mental health, it also affects your social relations, and also poor hormonal health. Growth hormone is important for, it's like technically an anti-aging hormone that we make. It helps to repair, and this is also made in the deep sleep, in the first few hours of your sleep. So if your sleep is interrupted in the first few hours of your sleep, or when you go to bed, this gets very adversely affected, and so are the sex hormones like testosterone. And we also know if we have poor sleep, we end up making poor health, poor dietary choices, and then obesity sets in. And the common reasons for poor sleep: shift work. Most of us are shift workers, and this is a big barrier towards getting a good sleep. Then sleep apnea, underdiagnosed, commonly seen, and very rampant. So that plays a good role here as well. Alcohol is a big sleep disruptor, and I will go over this in my later slides. And completely off circadian rhythm, we are not in sync with our circadian rhythm. That also affects our sleep quality. And stress, anxiety, poor metabolic health. Like if you have to get up to pee 3 times or 4 times a night because your sugar is high, then how will you sleep? And excessive use of caffeine, and as healthcare workers, we do fight our sleep. A lot of time we need a lot of mental alertness, and we overdo caffeine, and which is again, it's a deterrent to our good sleep. So, and before I go to the next, because now I'm going to give you some tools on how to optimize our sleep and other activities. Just keep these 2 neuromodulators in mind. So dopamine, it's a neuromodulator. That means it modulates the function of different parts of a brain. And there is a baseline level, and there are peaks in dopamine level. Dopamine is associated with planning, with movement, and with pleasure. And it's a non-discriminatory neuromodulator. If you increase your dopamine in your brain from any activity, that dopamine you can use towards some other activity where you need movement, where you need motivation. So you just have to take your dopamine levels up, and its non-discriminating neuromodulator will help you to focus on other things too. And serotonin is a neuromodulator of happiness and well-being, contentment. Meditation practices, that's where serotonin goes up, and that gives you that general feeling of well-being and happiness. I already went over this. Hormesis is basically physical stress. It could be heat stress, exercise, cold exposure, fasting. But again, what doesn't kill us? So we don't go overboard and kill ourselves, just the right amount and the right the frequency as well. So let's start with waking up. We have done sleep, and I'll go over sleep once again at the end of my presentation. So when we wake up in the morning, there are few things that are going on after a good sleep. One is that we have adenosine floating in our brain. So adenosine is made during the wakeful hours. As soon as we wake up, adenosine starts going up. And this adenosine keeps building up in our body, in our brain, and then when it reaches a critical level, that's when we feel sleepy. That's cause for the sleepiness we have, that no, I need to sleep now. So that might be still floating in your brain and your CSF, and that has an implication for caffeine intake. So I would highly recommend, do not go for your first cup of coffee or tea as soon as you wake up, because there is still adenosine floating. And caffeine binds to adenosine receptors, and it displaces adenosine, and it does it for a few hours. Its half-life is around 6 hours. So what happens, this adenosine, unless it's attached to its receptors, it is not degraded, and that keeps going. That's high. Now you have caffeine that's gone and sat on the adenosine receptors, and now this adenosine is still flowing there, and once the caffeine half-life is coming close to end, adenosine will go and attach to its receptors, and you will have a crash in the early afternoon or so. So if you delay it by an hour or two, let this adenosine get washed out of your system. That will make a big impact in the afternoon crash you have. Also, cortisol is trying to peak. There are two major things that happen that wake us up. One is the rise in temperature. So our body temperature starts going up. There is a minimum body temperature that we reach before 2 hours before we wake up, and once that's reached, now the body temperature starts going up, and when it's up by 1 or 2 Fahrenheit, now we are up. Now we want to get out of the bed, and cortisol is also trying to peak at that time. And there is lingering melatonin, and so melatonin is made in response to darkness. So adenosine is by waking up, just by the way we are awake, adenosine is being made, but melatonin is made when it's dark, when the sun has set, the lights are low. That's when melatonin is made. That's also still lingering on at the time when we wake up, and it has an important implication on pancreas, because pancreas has melatonin receptors as well. And when melatonin is attached to these beta cell receptors, the insulin production is low. So already our sugar is going up because of cortisol, and we are less insulin sensitive around that time. And we also wake up dehydrated because we haven't had any fluid at night. And also some of us might feel low motivation because our dopamine levels are low. We don't want to get out of the bed, no movement is happening. We may just put the sheet back and say, okay, maybe another 5-10 minutes. So now these are the tools we can use to optimize, to undo what's been done during like the early hours of waking up, and how can we set things right. And almost all these activities are going to set up the stage for a good night's sleep that night. They are all interconnected. So how can we start our day? So the first thing that you can do as soon as you wake up, or 3-4 things you can do as you want, like however you feel. So viewing unobstructed sunlight, that's that's a trigger for it tells our brain and it tells our prefrontal cortex that it's time to wake up. So all the parts of the brain, they get activated as we view bright sunlight or sunlight in the morning. If it is not bright, even if it's a cloudy day, there's still enough light, enough photons, that if we spend little extra time, we will get that benefit. So I would suggest 5 minutes if it's a bright sunny day in the morning, and 20 minutes if it's overcast, that you should spend outside, and it should be unobstructed, not through a window. Let light come on your face directly. That's a good exposure to light. And the light has to, and sun at a lower solar angle. So when it's above the head, then the light spectrum changes. It's the lower solar angle is the one that's very important because of the contrast of the blue and yellow light. So that time in the morning, that's the best to view sunlight. Then doing a brief zone 2 exercise, because all these things that we do, they will increase our cortisol, and we will achieve our cortisol peak very early in the morning. And that is what we want. We don't want cortisol peak late in the afternoon, late in the evening, because when cortisol peaks, 12 hours to 14 hours after that, melatonin sets in. So you're setting that night's good sleep by peaking your cortisol right early in the morning. So zone 2 exercise. So I will go over what is zone 2 exercise, but just like you can even stand on a spot, do a 5-minute or 10-minute a quick fast jog, and that will also set up A, your cortisol will start going up because of exercise, and B, your dopamine levels will also go up with the exercise. So 5 minutes of viewing, or 5 to 15 minutes, good summer days 5 to 10 minutes, then 5 to 10 minutes of zone 2 exercise, so almost close to 15 minutes or so, 20 minutes. Then rapid breathing. So with a rapid diaphragmatic movement, that is also a potent stimulus for cortisol to go up. It's like, it's a primitive response. It's like if a lion is chasing me, my diaphragm is moving fast because I have to breathe, I have to run, my cortisol will shoot up because that's life-saving. So that's another way of peaking your cortisol early in the morning. Cold exposure. Cold exposure is a very potent way of increasing your dopamine, and some of my friends I've been pushing them to do it, and some of them have been doing it. I have to get their feedback, how they've been feeling. So cold exposure is a very potent stimulus. It has multiple benefits which I'm going to go over. And then avoid caffeine, as I said, in the first 2 hours, or first hour at least, and avoid eating as well in first or 2 hours after waking up. And I will go with the philosophy of time restricted feeding in that, because there's some controversy around it. Should it be done or shouldn't it be done? And again, the reason is because our pancreas are not that sensitive when we wake up because of floating melatonin. It's not, and cortisol is peaking. Already liver is churning out glucose, so you don't want to add on to the glucose spike that is going on at that time. So deliberate cold exposure. Why deliberate? Because if it's not deliberate, that is not good. So it shouldn't be a forced cold exposure. So there are multiple benefits of cold exposure. So one is that it increases your dopamine level, and that dopamine level is up to 250 times. And if you look at literature, it's probably, I think it's almost the only activity that will cause sustained increase in your dopamine levels. So if you do a brief cold exposure, and I'll tell you how much you require, once you do that, your dopamine levels will shoot up like very high, and that will be sustained over 4, and some of the studies have showed even up to 8 to 10 hours. So think of another very strong dopamine stimulus is cocaine, and that peak is also very high, but that lasts for only few minutes. So few minutes versus many hours, that's a difference here. So it also improves our stress tolerance, because if you can maintain, so it's like you are flexing your muscle of stress. Cold water is very stressful. Like if some of you have taken these cold showers or cold baths, in the initial first minute or two, it's very stressful. And if during that time you are able to maintain your calm, that actually helps you to maintain calm during stressful situations. And some of us who are in procedural fields, we do see a lot of unexpected things. And I can tell you personally, when I am doing, if there is something that's not going according to how I would have wanted it to be, I think I'm pretty much calmer doing these activities, that you just deal with the stress much better. It also increases brown fat, and brown fat plays a good role in glucose metabolism, because what happens when we are exposed to cold, it's a shock to the body, and then epinephrine, norepinephrine, cortisol levels, they just shoot up right away. And this norepinephrine is a stimulus for the brown fat to proliferate. And when basically what is the difference between brown fat and the white fat or the visceral fat or the subcutaneous fat, is basically brown fat is very rich in mitochondria, and mitochondria is very good at using glucose. So by cold exposure, we can increase our brown fat concentrations, and brown fat is very close to our central nervous system. Nature gave it to us so that we could keep warm on cold nights, and also because that protects our brain, our CNS, from getting damaged, and even to maintain the circulation. So the quantity of this brown fat increases with cold exposure, and it also reduces inflammation. So there are also case reports on deliberate cold exposure that people have been able to overcome addiction. What is addiction? Addiction to what things do we get adapted or addicted? These are the things in which there is minimal effort, and with that minimal effort, we have a huge dopamine surge. Those are the things we get addicted to, like gambling. Just pull the thing down, you won a huge jackpot, that's a dopamine. Or you have like snort cocaine, no effort done, dopamine goes up, you get addicted. So how cold exposure, what are the transitions in cold exposure? So once we enter cold, let's say you have a cold bath, anything less than 15 centigrade is cold for us, studies have shown. And let's say you have a cold bath you put your bathtub, you filled it with water, it's at 6 or 7 centigrade. That's a temperature that we get in winters. Sometimes it can be as low as 5 in this part where we are. And now you go into the cold, the initial response will be like, it's a deep breath. It's like sympathetic surge right away, because it's a big shock. Now so we are doing deliberately, but the body doesn't know, and it wants that all the surge of cortisol, dopamine, because body wants movement. Body wants you to get out of this cold, find somewhere warm. So that's why dopamine, huge surge, you want to move away. So that happens, and if you are able to maintain your breath during the first minute, and you can calm it down, and it happens, there is a transition that happens. Once that happens, from the sympathetic drive, we go to a parasympathetic drive, and that is a very calming effect. And if you can maintain your calm while you're in cold, that's how you are adapting to stress. It also decreases our heart rate, and we know if our resting heart rate is high, that's not good for our cardiovascular health. So if you have a good cold exposure in the morning, and I've seen it on my tracker, my heart rate that day is lower, and that's a good thing. Let's go with the technique. So anything colder than 15 centigrade is fine, that will trigger the response. So duration can be anywhere from even 5 seconds, because you have to build this muscle. If you are not cold adapted, you don't just want to jump in cold water, your heart might stop, so you have to be careful. So anything from 30 seconds to up to 11 minutes, even higher if you're more adapted, that's all fine, but go slow. So what happens with that? As I said, there is an increase in brown fat, there's improved metabolism, and 11-minute exposure in total a week has shown in studies that it causes increase in brown fat and improved metabolism and lower blood glucose level. That's great. It's working like metformin here. And the types of cold exposures you can do is cold shower, cold bath, or an ice bath. The question is, how about I walk outside in cold? Yeah, you can do that. You can go in a t-shirt. I did this morning. I checked the temperature was -2 centigrade, and I was out for like 15 minutes in my t-shirt. So you can do that, but water is more potent because water transmits heat and cold much more than air would do. Try to breathe through your nose while you are in cold and take deep and easy breaths, slow exhalation, and calm down during the stress. Do not hyperventilate while you're in water, because the last thing you want to do is to pass out in cold water. Because if we hyperventilate, carbon dioxide can shoot up, it can also affect our circulation, and then it's not a good thing. And there's a cheat technique. One of my friends asked me, why didn't you tell me? Because obviously once you get used to it, you enjoy it. Okay? So that's like almost like an addiction too. But that's a cheat technique. So our hands and our feet, the circulatory channels are different here. So there are AV anastomosis here, and there is a tremendous amount of heat and cold exchange that happens at surfaces of our palms and our feet. And you can try it. You go in a hot bath or cold bath, and you have your hands and feet in there. You will want to take your hands out as the first thing, and that's what we do at night. We have our feet outside our sheets a lot of the time because we are trying to cool down ourselves, and that's a very important way, because these and also some area on face. Even like if you want to bring down temperature, if fever is high, cooling down hands, soles, and face, that can actually bring down the temperature much faster than cooling the rest of the body. Cautions again, do not push yourself. Shivering while in water is a warning sign that you're overdoing it. You're not adapted yet, because shivering can happen after you have done, once you've come out, because there is a little after drop. Your body is trying to heat, because there are two mechanisms of heating ourselves. One is through shivering, which is not as efficient. The other one is through brown fat, through glucose metabolism, because their mitochondria, instead of making ATP, will be making heat. So that's a much more efficient way of heating our body. So if shivering is happening in the body, you're overdoing, come out. Next day, little more, this is how you can do. After drop is a true thing, and you have to be careful. So what happens is, initially there's a vasoconstriction, and all our blood is into our core circulation. So our cardiac output, technically, because we have more circulation, more blood going to our heart, so it's all concentrated in the core circulation. Now when we come out, this vasoconstriction is going to open, and the blood will start flowing through cold extremities, and that's when the after drop can happen. It can go down further, so you have to be careful with that. And there's no need to dunk your head under cold water, because there are some studies which show that if you dunk your head under water, there could be some circulatory compromise to your brain. But there are winter swimmers who do that, and they're fine, but they're more adapted. So that's about cold. Any questions, quick questions I can answer, otherwise I'll go to the next one, it's exercise.
Any concerns for people who have sinus issues or cold issues, like cold allergies?
No. It's just, again, do not shock your system. It's hormesis. What doesn't kill you makes you stronger, so don't get killed, but it will make you strong if you find your sweet spot. So sinus issue is not an issue. Yes.
I have a question about the light. So some of my patients have these lights, lamps. I don't know if it's called the sun lamp, heat lamp. Are those effective as well in the morning time, or does it have to be like natural sun?
Not as close to sun. So if you can actually check, there is a luminous meter that you can check. There's even sunlight through window is much decreased as compared to sunlight outside. So these lights, I use it in winters because there's no sun, so I have it something. So That's another way. You can turn on the bright lights on, and you can have that, like, those simulated lights on, but that's no way close, but at least something is better than nothing. So winters you can do that for sure. But this time of the year, there's no excuse. Even if it's overcast, you'll still get enough light. You just have to extend the time from 5 minutes to 20 minutes or 15 minutes. That's what you can do. All right. So going to exercise now. Exercise is divided into 5 zones. Okay. So there is zone 1 to zone 5. Zone 1 is walking. It's gentle. Our heart rate goes to 60% of our max heart rate. So it's like almost like activities of daily living. This I find very useful after dinner, and my fatty liver patients who their glycemic controls are not optimum and all. So I tell them that after your dinner you should walk for like 20 to 30 minutes. It's a gentle walk. You're not running or anything. Just a gentle walk, room to room. If it's cold or it's warm, go outside and walk. That's going to bring down your blood glucose level before you go to sleep, because when we walk, we still, these big muscles, leg muscles, back and hands moving, that actually helps with glucose metabolism. Then zone 2 exercise. This is a very important zone of exercise, and if I have to give it in layman's terms, it is an exercise. If I'm doing this zone 2 exercise, I will be able to hold a conversation with you, but you would be able to tell that you are exercising. Let's say if you're having a conversation on the phone, and I've given an example here on the treadmill, how you can do. So if I'm doing that and I'm talking to you, you'll be able to say, yeah, you're doing exercise, but you can still have a conversation with me. So that's zone 2 exercise. If you go by the definition, it's the exercise in which you still can maintain your lactate levels less than 2. That's one way of doing zone 2 exercise. Is you can put your incline to 10 to 15 degrees and a speed of 2 to 3 miles per hour. You can walk or like uphill or on the treadmill, and that will give you zone 2 exercise. We tell our patients 150 minutes of exercise, but that's the least. You can do much more than that. So ideally it should be half hour of zone 2 exercise if you can do at least 5 days a week. And you can increase it to whatever your comfort zone is, but 3 hours probably is like, yeah, that's it. You're pretty good. And swimming, cycling, running, and rowing are also, you can use these to get your zone 2 exercise. Benefits: insulin sensitivity, brain-derived neurotropic factors, so it helps with brain metabolism and maintenance of neurons in brain, and positive impact on cardiovascular health and mitochondrial function. Zone 5 is like a lion is chasing you, you're running for your life, you give your best for a minute or two, cannot run for and if you're not doing it, if you're not getting exhausted by that minute or two, you're not in zone 5. So zone 5 is a very potent antidepressant effect. It elevates mood like one of our best drugs. So what you do is you run fast on a treadmill or outside, wherever, and give your max. Do it for a minute or two, then stop. Take a little rest. You can do it again. You can do up to 4 reps, and that's good for the week. You don't need to do it again because you've done that zone 5, optimum zone 5 exercise. Resistance training, that's my favorite. And there is so much benefit to this resistance training that I would highly recommend, especially women to do, because this is your antidote to osteoporosis, and this is your antidote to muscle loss, which happens with age. So you can do 3 to 5 sessions of strength or resistance training, and it also increases myokines. Myokines are proteins made by our muscles, and that helps to regulate other proteins. And it also improves metabolic health and helps in attaining euglycemia. So zone 2 exercise timing. So people have done studies on these two. When are they optimized? So the morning thing, I said you can run for like 5 minutes or something, just a quick one so that you wake up. So this morning helps you to peak your cortisol and increase your dopamine early in the morning. If you look at what time of the day we have the maximum strength, it's late afternoon, early evening. So if you lift weights you will see if you're lifting weights in the morning versus when you're doing it in the late afternoon, there's a difference. You can do much more weightlifting during the afternoon time. And this also is likely best for metabolic health, for optimizing our blood glucose and insulin sensitivity. So that time is is good. Most of us are working, but if you finish your work early, 4-5 p.m., that's a good time. Go and exercise, go to the gym. So the question always comes, should I exercise before going to bed? So I said zone 1, which is just a walk, is fine. Now should I exercise before going to bed? And there was this, and because of the mechanism, we would say, oh, the cortisol will shoot up, you will not be able to sleep, the temperature will go up. There's some truth to that. But again, the studies have shown that if you do exercise at least 2 hours before you hit the bed, that's more beneficial in keeping the depth of your sleep. It does not disrupt your sleep. In fact, your depth of sleep and your interruptions in sleep will be much less. So you can exercise up to like 2 hours before you hit the bed. Problem starts after just in that 90-minute period. So in that 90-minute period before you hit the bed, you exercise and you're going to zone 2, zone 3, zone 4. That will raise up your body temperature, and body temperature has to fall by 2 Fahrenheit or 1 centigrade or little more than that before you sleep. That's when we transition from wakeful state to sleep. Body temperature goes down. But if it goes up, with exercise cortisol goes up, that can increase your sleep latency. It will take longer for you to fall asleep, but once you fall asleep, your sleep might be quite deep. So it still is beneficial. Exercise is beneficial than no exercise. So you should do that, but timing, if you can make it optimized, that will help you even more. I want to go on muscle. Muscle is currency of aging. It decreases by 3 to 8% every decade after the age of 40. And it's accelerated after the age of 30 and after the age of 60, and an average man will lose 30% of their muscle mass in their lifetime. Also know grip strength is a good predictor of mortality. If your grip is gone, if you have to give somebody else to open the bottle, something is wrong. You should be working on yourself. It also helps to prevent falls and muscle, so protein consumption, and that's a big part of nutrition. We are not very good with protein consumption. As we get older, our protein assimilation goes down as well. So make sure you get adequate protein, whatever source, and do exercise to keep a good muscle mass. Yoga is another form of exercise, and this is, I would say, this is yoga, tai chi. These are all I would put in the same category. And the beauty of yoga is it combines mind, body, and breath, all three together. That's a package. There's not much of weightlifting and all, but still it's your own body weight you're using. It activates parasympathetic nervous system, it improves strength and balance, and can be easily learned, incorporated in your morning or evening schedule, and it improves focus, improves circulation. And yoga is gentle. All those contorted postures and doing all these running and heating the rooms and all, that's not really required. Yoga is about, is unique. It's when your breath, mind, and body, they're all. So they're like in yoga, like you bend forward, there's a different breath you have to do, like in exhalation, inhalation, and then you go back, there's an inhalation. So this is all coordinated in yoga. Breathing and pranayama, these are also very potent techniques. Like I said, breath work that you can do in the morning is rapid breathing, which I'll be covering very briefly on the next slide. And breathing pattern changes the state of your mind, and your state of mind decides your breathing pattern too. If you are stressed, worried, your breath is fast. If you're calm, it's slow. There are a few types of rapid breathings. One is tumor breathing, also Wim Hof breathing. They're similar, quite similar. There's a Bhrastika pranayam, there's a Kapalbhati pranayam, and these are all rapid breathing pranayamas that you can do. There's an alternate nostril breath, which is slow, deep, quiet. It's called Anulom Vilom, and it's calming, it's for focus. And then the last one is humming breaths, when you make this humming sound. And it's been seen that when we make humming sound, our nitric acid production goes up in our airways, And nitric oxide is a potent vasodilator and it's good for our cardiovascular health. So that's another benefit of this humming breaths. Food timing is important. We already went over this. Now, time restricted feeding, and I'm pretty sure a lot of us are doing time restricted feeding, and the questions come, is it good? Should we do it or shouldn't we do it? And the studies after studies are showing that if weight loss is your goal, low calorie diet and time restricted feeding are almost very close to each other. There's not much difference. Though there are certain nuances to time restricted feeding which have not been looked into those studies, like the protocols, but not in tune with the time restricted feeding that would have been done. And so there are studies going on. And fasting is another way which is an hormetic stress, and it helps to reset our immune system. A lot of things with fasting, and fasting protocols are now even being used in cancer treatments to time chemotherapy and other treatments. Food choices, we know this. It's just quick ones. Avoid processed foods. I tell my patients, do not eat anything out of a box or a packet unless it's nuts. Rest of it, you don't need to. If it comes out from a factory, it's been manufactured, you want to avoid it. High fiber diet, protective for cardiovascular health. IBD, low risk, especially fruit fiber, and it improves gut microbiome, increases butyrate production, which is all good for us. And fermented foods, important. There was a study out of Sonnenberg lab, and that's a very reputed lab in nutrition, and they found that fermented foods like sauerkraut, they increase your microbial diversities many folds as compared with just a high fiber diet. And in decreased microbial diversity is central to irritable bowel syndrome and inflammatory bowel disease, both. So having a small serving of sauerkraut, kimchi, or something fermented is going to help restore your diversity of your gut bacteria. Avoid too much simple carbohydrates, avoid added sugars, and refined grain consumption. And even I say be cautious with grain consumption, because grains are also very high in sugar content. Do you really need to eat that much grain? Because grains were introduced much later from our food gatherer hunter tribes to lay much later on, and then food, and because grains have to be cultivated, they just don't grow in forests like in the amounts that we eat. I won't be able to even fill a bowl if I go and try to find out in wild. Also, there's controversy in seed oils versus avocado oil or olive oil. Their healthier choice is olive oil and avocado oil. Studies are still not supportive of one versus the other. And diet rich in omega-3, that's important. Omega-3 is an important part of our brain, it's an important part of our immune system. So seafood gives us long chain omega-3, and nuts and give us the short chain one, and the long chain ones are very important, and that one of the sources is seafood. If you're vegetarian, you can have algae oil that has omega-3 as well. So, and you can also increase consumption of nitrate-rich foods like beets, arugula, and foods rich in arginine, that all help us to make more nitric oxide. I already went over this time-restricted feeding. The one concern that's being raised again and again in time-restricted feeding is lean muscle loss. Is that important? Yeah, it could be if you're not. So if somebody is really into time-restricted feeding, I tell them two things. Make sure your protein consumption is good, and make sure that you exercise, you do some resistance training, then you can maintain your muscle mass. Alcohol, new guidelines, we know 2 drinks a week increases risk of cancer if you consume too much. It's a significant disruptor of sleep, it causes fragmented sleep, no cardiovascular benefit, bad for gut microbiome, disrupts gut barrier. So the so-called leaky gut, that's all affected by alcohol. These are different types of diets. Out of all these diets, Mediterranean diet carries probably the most evidence for its benefits. So, and Mediterranean diet as in it's followed in Mediterranean, not the way we think of Mediterranean diet, going to these fast food joints where they say Mediterranean, it's not truly Mediterranean. So you can do some research on that. Now, we've done all this, now we're preparing to sleep. So avoid caffeine after 2 to 3 p.m. because half-life is 6 hours to 8 hours, and we have different metabolisms for caffeine. Some are high risk, like very sensitive. And if you have caffeine, so some people will say, well, I have caffeine and I can sleep in like 2 minutes. Well, they can sleep, but it's been studied that even if you fall asleep early, you might still have disruption on sleep, and you may not sleep that deep if you have consumed caffeine in the late hours. Avoid bright lights, that's very important. From 10 p.m. preferably, or 11 p.m. to 4 a.m. There is a pathway through habenula it's in our brain, and there is a pathway that goes to pancreas, and bright light exposure disrupts glucose metabolism adversely. It's that during the late hours, so avoid that. Red lights are fine, or the low set lights like lamps rather than having ceiling lights. So because it's the lower retina, when this light falls, that's when it gets activated. So if the light is at the level of lamps and all, it's less of light there. Try to fix a bedtime. Keep it 30 to 60, within plus minus 30 to 60, because it's in that pattern. Let's say if you sleep mostly at 10 p.m. So if you hit bed at 10 p.m., within the first 2 hours till midnight, 12 a.m., that's when your growth hormone is going to be secreted. But let's say if you push to 12, and now between 12 to 2 p.m. that night, you may not have the growth hormone surge, because this follows a circadian rhythm, this follows a pattern. So try to maintain that pattern. Heat exposure, which is one of my favorites, which I'm going to go over next, that helps you to fall asleep, and I'll tell you the reason in the next slide. Avoid cold baths, cold showers, because it's going to increase your cortisol and will be disruptive to your sleep. And meditation, breathing, there are different kinds of breaths. One is physiological size, and then 4, 7, 8 breath. So these can be done before you go to bed. Heat exposure, it has been quite well studied, though it has been studied in Scandinavia, but it has tremendous, in the studies it's shown tremendous cardiovascular benefits. And I again give you a protocol here. So this study was done the studies have been done to assess how much sauna exposure is good for cardiovascular health. So 20 minutes of exposure at 175 Fahrenheit or above for 4 to 5 days a week reduces risk of cardiovascular mortality and sudden cardiac death by 50%. That's a huge dent. Which drug does that? If you do it 2 to 3 times a week, it reduces by 27%. It's been published in JAMA. There is an improved arterial compliance with saunas. There is reduced risk of hypertension. Your systolic blood pressure as well as diastolic, they drop. And repeated sauna therapy also improve myocardial perfusion in patients with coronary artery disease. There are different kinds of saunas. There are Finnish saunas, which are direct heat with ambient heat, like heat, it's through the air that's heated. And then there are infrared that fall on the tissue, and then these infrared it increases your temperature. Also, heat exposure reduces risk of ischemic strokes, almost 60% by the same protocol, 20 minutes, 175 Fahrenheit, 4 to 5 days a week. Heat shock proteins, they increase, and heat shock proteins are chaperone proteins. They maintain integrity of other proteins and the vital proteins that we have. And so sauna exposure increases our heat shock protein, and also our heat acclimatization, it improves, and we start sweating at lower temperatures, and at that time also our heat shock proteins go up. So that's benefit even at lower temperature if you have been exposing yourself to high temperatures. And sweat is a potent way of getting rid of cadmium and lead, and because these can be excreted, they are not excreted as much in urine as much in sweat. So that's another way of getting rid of these heavy metals. It also increases resilience like cold, and it may improve our immune function as well. Studies have also shown that sauna actually almost mimics aerobic exercise. So 25 minutes of sauna versus 25 minutes of stationary bike, their physiological benefits are similar in improving our increasing our heart rate transiently and increasing our cardiac output. And this I've already covered. And also it's another way of preventing muscular atrophy. So let's say if you have an injury or something and you cannot go to your gym, if you expose yourself to sauna, it protects your muscle mass from going down. And it's been studied in people who have had immobilized legs due to fracture and all. They were exposed to sauna, and the atrophy was much less if they were exposed to sauna versus not exposed. So if you're not able to do it, exercise, go and do that. So how sauna or heat exposure helps us to sleep? It increases our body temperature, and our body is very efficient in cooling down, and it cools it down very fast because it's important for the body to cool down. And when that happens, 1 to 1.5 centigrade temperature drop will happen much faster, and then you will fall off to sleep much easier. So that's another way of improving your sleep. Or if you have problems going to sleep, that helps. Also, if you pee, like you wake up in the middle of night to pee a few times, you sweat, your antidiuretic hormone will go up, and you probably will not pee as much. Your sleep will be less disrupted. Now, there are different breathing techniques, and I don't want to go over time, so I've already gone 5 minutes above. So if we have time, if people want, we can do a quick 8 to 10 minute meditation session in which I will go over these breathing techniques, how they can be used. But I'll just tell you quickly about this physiological sighs, because there is now evidence on that. So what is a physiological sigh? Anybody knows here? So when a child cries, or anybody cries, what they do? That's a physiological sigh. It's basically what we are doing is on a full breath. So we have taken a breath, and then we take another breath on top of that without exhaling. And what it does, it's a very potent carbon dioxide washout technique. That's number one. And it's been shown that it activates our parasympathetic nervous system even more than meditation. It's been checked head to head. So it's a very quick way of changing from a high sympathetic drive to parasympathetic drive. And you can do it in your office. It's just busy, busy, busy. You're going back to back to back. Just close the door. Take a 2-minute break. Even 4 to 5 these breaths will really calm you down. Your heart rate will come down, and we can do that quick if we have time. Then again, sleep is, try to make it non-negotiable. Prioritize it. There is evidence that less than 6 hours of sleep will almost 100% affect some parameter in your physical or mental health, and avoid disruption, because if you're disrupted fragmented sleep, the hormone homeostasis will be affected. So summary: morning sunlight exposure, 5 to 10 minutes of something quick, even stand at a spot, run. Rapid breathing, if you want to do tumor breathing or different pranayamas. I told cold exposure, if you don't want to put your body in cold, hand, feet in cold, 2 or 3 minutes, that's it. It will wake you up. And delay caffeine or food by 1 to 2 hours. Afternoon, avoid caffeine after 2 p.m. Exercise in late afternoon or early evening will help you with a better metabolic health, with better glucose metabolism. And evening is finish eating 2 hours or 4 hours before you go to bed. Avoid bright lights after 10 p.m. if possible, at least by 11 p.m. Gentle walk, that's good. You can walk with your family, friends, if in community, and that will help you to have social connections too. And heat exposure and consistent time to go to bed. Again, not fanatic about it. Sleep should not take away your sleep because I didn't sleep. No, don't do that as well, because that's counterproductive. Our body is smart. If you don't sleep, next day it will do some catch up, not all, but it will do some catch up. And whatever stage of sleep that has been compromised, that will be probably the most caught up the next day. Like if you don't get non-REM sleep, let's say dream, next day you will have a ton of dreams, and this is what happens. So I'm a little over, so I will stop here, and I'm happy to take any questions.
Excellent, Dr. Girish. Very, very comprehensive. Thank you. Which light did you say in winter? Because in the winter you really cannot go outside. Most of us now with t-shirts. but which light indoors can be installed?
So they're available. So on Amazon, you can put bright, like lights, daylight simulation. So it's like $20, like an iPad. It's very bright light, and you can put different modes on it. So I have a couple of those in my home. When I wake up, when I'm doing my exercise, yoga in the morning, I have it on next to me, and that gives me light. And as soon as sun is out, still go out, get some sun. That was really going to set your rhythm up. So make it almost non-negotiable. So my technique is, what I do is I wake up, and it's a funny way. What I do is, my backyard is east facing, so I take a bowl of my matcha tea, because again I wanted to go over polyphenols. It's very important in our nutrition, and polyphenols are basically chemicals, phytochemicals that plants make to protect themselves, and they are very high in berries and coffee and matcha. So I take a bowl of my matcha. I go with like t-shirt, bare feet. If there's grass, if there's no snow, I just walk on it for 10-15 minutes. I get sunlight, and it does almost everything for me. I've had a walk, I've had my polyphenols, I've had cold exposure, and I've had sunlight. So all done in 10 minutes. So this morning protocol I told you can be easily done in 20 minutes. And please invest this time in your life. 20 minutes in the morning out of 24 hours. It can make a huge difference to your life. So please try to incorporate.
Low vitamin D. Do you have any comments how we can improve in the natural way? I know we tell you to supplements and
I see a lot of vitamin deficiency in my IBD patients, celiac patients, and in fact some of them have undetectable levels. It's an easy fix. You can, so sunlight, but that sunlight has to be morning sunlight, not as much vitamin D, but when the sun is up on the head, like 12 after that, that's when we make more vitamin D. So exposure in sun, so again safe exposure. You don't want to get sunburn, that's very bad. You don't want to get melanoma, so you just, as safe sun exposure is good, but you can supplement vitamin D anywhere from 1000 to 2000, but check the level, just don't do blindly. I have patients who are on 5000, 7000 units a day, they still have barely normal vitamin D levels. There's a new kid on the block, vitamin K2 as well. So this was discovered in mid-90s, and that's also considered something important in the calcium. It's considered important in calcium metabolism, and it's supposed to keep calcium in bones and not getting accumulated in our blood vessels and ectopic places. So vitamin K2 is catching up. There are studies going on it, and it's supposed to have some cardiovascular benefits as well. So on your coronary artery disease. So it doesn't harm to take vitamin K2. The natural sources for vitamin K2 is fermented foods, and like yogurt and natto and all. And vitamin D you can get by supplementation, 1000, 2000 units. Check the levels.
You did answer partially my question about South Asian specific fermented foods.
South Asian specific fermented foods, so kvass. So kvass is technically not South Asian, but we do something traditionally in our diets. It's you ferment carrots. So it's very easy. Kvass to make is very easy. Kvass is so what you do is you take beet, put salt in it, put some water, preferably water from you can boil it and put because you don't want too much chlorine in it, and then you keep it aside and it will ferment on its own. And you can even put non-iodized salt and little bit of apple cider vinegar just to keep fungus from going on top, and it actually accelerates the process of fermentation. In 3 days, a sour, dark, deep purple drink is ready, high in arginine, good for nitric oxide production, extremely good for gut microbiome. So I sometimes advise my patients whom I think their microbial diversity is not good to consume that. So we do, it's in North India they call it kanji. It's basically fermented carrot. So that's a very good fermented food that you can have. Yogurt is fermented too, kefir is too, but the problem is they add a lot of sugar in those things. So that's why these are lower hanging fruits for us.
I have two questions. One is the saunas that you mentioned with the reduction in cardiovascular disease risk. What type of, is it, you mentioned a couple of types, infrared and others. What was the one in the study that was?
So most of the studies are done on the Finnish saunas, the heat ones, so the ones with heater. So how they do it is different from what we do it in our gyms here. So we are not allowed to put water on the heaters. So how it's done in Finland is there is a heat exposure, and they finish it by putting water on it, so there's steam. Now it's even higher, so steam is even hotter. So that's how they build up. And there is also something known as contrast baths. So you have, like, you've done this 20 minutes of sauna exposure or less, depending. Again, don't jump into it, because again, there are certain contraindications. One is aortic stenosis, especially if it's a higher degree. The other one is unstable angina, so don't do it in those situations, or somebody with very high blood pressures and all. So what you do is heat exposure, then cold exposure, then heat exposure, then cold exposure. If you do it once a week, not more than that, once a week, there's a massive increase in your growth hormone by doing that. So that's, again, these protocols you can use. What is your practice? Like time restricted feeding. What do you want to achieve? You want to achieve weight loss? Well, you can achieve with low calorie diet. But you want insulin sensitivity, you want, more growth hormone, all those things, then you can start looking at time restricted feeding. So it depends on what you want out of it, and then you adapt your protocol accordingly. So it's, to answer your question, it's Finnish. One study was on infrared saunas in the coronary perfusion that I showed. Both are fine, but so to achieve a temperature of 175 with infrared is a bit of a challenge, and because it has to come on you heat up, but whereas in Finnish it's the air that's heated.
Sorry, just my second question was, what's the, like, you said K2, I know there's like K2 with vitamin D, like what's the combination that you recommend? I've had some patients come to me and say, hey, I'm on this K2 and D, and I'm like, yes, so, but I don't know about the combination.
So K2 is, so the active form is MK7 as far as I remember, and the combination you don't have to like you can take separately. If you're asking me the dose, I might not do justice with the dose, but it's 100 micrograms or something like that. It's so you can check the dose. There's a recommended dose that you can have. So I don't remember offhand the vitamin K2 dose. The other important mineral deficiency we see is zinc, and especially in our IBD patient, almost 85% patients with IBD who have diseases under remission, even they have vitamin zinc deficiency. So imagine if the active disease, they will. So zinc is also, so to get your minerals, it's not very difficult from food. You don't need to buy supplements. Just mix some nuts. So nuts have a lot of, nuts are mineral concentrators. So like if selenium, which is important in our thyroid function, so you can have Brazil nuts. So 5 Brazil nuts if you eat, you'll get enough selenium. In fact, don't eat too much because you'll get too much selenium. So you can have pistachio, almonds, walnuts, Brazil nuts, and you will get most of your minerals, and seafood also. It's very rich in minerals. So you can get that from that. Bajaj website in making. So this is, it's compilation from different sources. There's no one website which is, and believe me, I give a lot of these tips to my patients for their general well-being, and because if you do the right stuff for the body, your body is intelligent and smart enough to restore its function. So by doing these things, you give the right stimulus to your body. So there is no one website that I can. Like if you want a diet talk, I'll be happy to do it at some point for you. I can do the nitty-gritty of all diets you want. So, but it's again compilation from different resources. It's not just one, and that's where, like, because you have to go with the literature to see whether it's of any good use or not. So it's not one site as far as I know. Any other question? All right, so I've gone, like, it's 1 hour. If you want a brief meditation session or keep it for some other time, it's fine, whatever you want. And so just informal, raise hands if anybody wants how many? Just 2, 1, 3, 4, 5, 6, 7. Okay. All right, so should we do it then? 10? Okay, it won't take too long, 10. So you want to dim the lights in the room? Can we dim the lights? So I'll be using here 2 breathing techniques. So one will be humming. So basically what you do is you make humming sound as long as you can make an exhalation. You can close your ears if your hands don't get tired, and and again this humming sound increases our nitric oxide level, so we can do that. And we will do it for maybe like 5-7 times, and then after that we will be doing physiological sighs. So breathe in. This we'll do 10-12 times, and then I'll just guide you how to focus on your heart and stuff. Okay, so let's start. All right, so you can close your ears if you want to, otherwise just breathe just like that, and let's start doing the humming sounds. Close your eyes, sorry. Little louder. If your hands are tired, you can keep them down. So breath in. Keep eyes closed. Now just regular breathing pattern, the way you're breathing normally. Keep your eyes closed, keep your hands, your palms on your thighs, facing upwards or downwards. Just follow your regular breathing pattern. Just feel your breath. Now feel that your breath is going towards your chest, towards your heart, directly into your heart. Slow and easy breath going towards your heart, and a slow and easy breath outwards. Again, feel that your breath is going to your heart. Feel the loving touch of your breath on your heart. While you're breathing, give your heart a lot of love. A love that you have for your child or somebody whom you love. While you're breathing in, feel that love for your heart at your heart center, which is in the middle of your chest. This nice, calming, soothing breath is giving a lot of love to your heart. Almost feel as if you are giving your heart a hug, a loving hug to your heart while you're breathing. It's been taking care of you. Love it like a child. It carries a lot of pain and stress. Give it the warm hug through your breath. Feel those gentle vibrations with your breath on your heart. Loving hug with every breath, as if you're hugging your heart, trying to soothe it. You can focus this love on any organ in your body that's been bothering you. Your knee, your stomach, your head, your shoulder. Just focus this love there. Hug that part and feel the gentle vibrations of your breath going to that part of your body. A lot of love. You have a lot of love, lot of capacity to give love. Give it to your heart. It's like a child can get scared at times. Give that comfort with your breath. Almost thanking your heart for working day and night for you. You can even keep your hand on your heart if you don't feel it, and give your heart gentle love through your hand, through the breath. Feel that your breath is sending vibrations to your heart through your hand, and like a child, take care of it. Gentle breaths. Smile at your heart. Now you can just gently open your eyes, rub your hands, make them warm, and you can keep them on your eyes. And that's it, 8 minutes. Alright, so we can up the lights. It's done. Thank you for your patience for more than an hour. So